afternoon to all my seniors and my colleagues. I am Dr. Vivek Menon. My mentor is Dr. Arvind Kulkarni. So, as we all know, that osteoporotic compression fractures is very common and a debilitating condition in the old age, and around 8.9 million people are affected every year. So, percutaneous vertebroplasty is a well-established modality for the treatment of this OVCF, and so many studies were conducted in this aspect, comparing percutaneous vertebroplasty along with conservative treatment. So now the million-dollar question is, what is the ideal timing of performing this procedure, this percutaneous vertebroplasty? So in my study, I have compared this objective. This objective is a ideal timing of vertebroplasty using data present in published clinical trials with respect to the pain relief, mobility, and complication rate. So we have taken the systematic review of literature that PubMed English Journal from 2000 to 2021, and total number of 107 abstracts were reviewed, and randomized control trials comparing conservative and placebo with percutaneous vertebroplasty was included, and we excluded all case reports, animal studies, non-English text, retrospective studies. A total of 15 studies were taken and a power of 1,606 patients. In that, 866 patients underwent percutaneous vertebroplasty and 740 patients underwent medical or conservative treatment. So, as we all know, the compression fracture is common in females. The power was more for the females. It was around 1,135. So, I am just going through some of the studies which I have taken for this study. So, when we are comparing these studies, the primary outcome which was used was VAS score. Along with that, they have already also used ODI scores, vertebral body height maintenance, local kyphosis angle, and analgesic requirement in this. We have taken these outcomes and compared with the patients to know how much is better and what time it is better to do a vertebroplasty. So these are some of the studies. In that we can see that Firanzu, Hansen, Klassen, Fitzwell, all these studies are showing that it's better to do percutaneous vertebroplasty less than 6 weeks of duration. So it's better to do less than 6 weeks duration. And in the other studies, the Buchbinder study, it was a long study comparing almost 12 months of study. In that they have found that both percutaneous vertebroplasty and the conservative group is having the same result, but the duration of the study was long. Then Clark et al., Diamond et al., Farooqi et al., everybody has done the studies comparing vertebroplasty with the conservative management, and they have come to the conclusion that it is better to do the vertebroplasty within 1 to 6 weeks. So when we are seeing through the pain scores, we can see, I just want to focus this immediate PVP and 1 to 2 month PVP. We can see that there is instant relief of pain, like around 33% reduced within 1 day and 55% within 1 to 2 months, and it was 74% reduced in 6 to 12 months as compared to the control group, which was only 3% reduced in the immediate and 7% in 1 to 2 months and 48%. So in Clark, we can see that there is a drastic change in the pain score between the PVP patients and the control group. And as when we are comparing it with the immediate PVP and 6 to 12 months duration, we can see that it's better to do initially within 1 to 6 weeks than to do after 6 to 12 months. This is a graphical representation. It's taken from Klassen and Clark et al. Publications. So in this we can see that this graphical representation, you can see a broad base at the baseline and up to 1 month as compared to the 1 year duration. So this graph is tapering towards 1 year, and it is broad in the first 1 month. So in this, I'm just going through the analgesic requirement. You can see that analgesic was stopped or 50% reduced for the vertebroplasty patient initially as compared to the conservative group where there was no relief. As compared to the no change. There is no need of any analgesic as compared to the analgesic requirement in terms of conservative patients, which was very high. I also want to focus you on the 6 to 12 months duration, because if vertebroplasty is done after 6 to 12 months, it's almost similar outcome in vertebroplasty and the conservative group. So when we are comparing the vertebral height, Clark et al., they have Clark et al.'s Clark et al., we can see that 63% of the vertebral body height is maintained in PVP than 63% of the vertebral body height is lost as compared to the vertebral body height of the other. So I just want to go through the complications also, in which the percutaneous vertebroplasty, there is a semen leak of 133 patients as compared to the control group, where spinal cord injury is more, and new fractures is more common in control group than in the vertebroplasty group. So this may be the fate of the patient if we are not doing vertebroplasty in time. So it can lead to a multi-level fixation. And just to conclude, I just want telling that early PVP provides faster pain relief, less analgesic requirement, fewer complication, vertebral body height restoration, shorter hospital stay, and better radiological outcome. So we just want to recommend vertebroplasty to be done before 6 weeks.
Thank you.
Yeah.
Thank you very much. As we have short of time, okay, we can ask later on. Yeah, next paper is by Dr. Atif.